and I'm a birthmark surgeon at that time. So I go to UCLA. I went to plastics, who had the main recon program for pediatrics. They told me to fuck off. I went to facial. They told me to fuck off. I went to USC, both plastics and facial plastics. They told me to fuck off. I went to dermatology, same thing. I went to Children's Hospital, and they said, okay, you can operate here. We're just not going to pay you. I'm like, all right, that's fine. I kept trying to meet people to get their referrals for me, for saying I do birthmarks. I'm not going to take what you do. And I kept going to try to find referrals from people. Ultimately, very early on, I said, fuck this. I'm going to develop.
Welcome to the DIEP End. Today, we're joined by Dr. Ben Talei, dual board certified facial plastic and reconstructive surgeon, founder of the Beverly Hills Center for Plastic and Laser Surgery, and one of the leading voices in facial aesthetics. A California native, Dr. Talei completed residency training in head and neck surgery at Columbia University, Cornell University, and New York Presbyterian Hospital. He furthered his training as a fellow at Memorial Sloan Kettering Cancer Center before completing 2 more fellowships, one at the New York Center for Facial Plastic and Laser Surgery and another at the Vascular Birthmark Institute of New York. In this episode, we discuss his journey into facial plastic surgery, building a practice from scratch in Beverly Hills, facial aging and rejuvenation, patient psychology, social media, and why he believes surgical vision is more important than any single technique. Let's dive in.
Welcome to another episode of the DIEP End podcast. We're here with Dr. Ben Talei, and we're super excited to have him. Number one, we were just talking about that we interviewed somebody last week, Dr. Macias, who talked so much and so highly of you and your impact on his career in aesthetics. And obviously, we'll get into this a little bit more, but you're somebody that so many people look up to when it comes to facial plastic surgery in general. And so we're truly honored to have you on. So thanks for joining us.
Thanks, I appreciate it. Excited to follow in the footsteps of Louis Macias.
Yeah. Hank and I always talk about this a little bit, but the nice part about this podcast is a conversation and getting to know one another beyond what we get invited to talk about at conferences or what we can read about, and that a lot of people may not know. So clearly you've made such an incredible footprint in LA and in facial plastic surgery. But if you were to rewind many, many years, or maybe not so many years, but to your childhood and your early influences and your path to medicine, can you tell us a little bit about what shaped you? Any major mentors or anything like that?
Sure. Well, medicines for me, it was one of many things that I was obsessed with. I'm kind of an obsessive person. I love to do things and know things. The point at which I decided to be a doctor was like legitimately about 5 years old. So it was through my
Wow.
Yeah, Dr. Zlotnick, this guy in San Jose, just made me feel very comfortable when he had a stethoscope on my back and my chest, and like you just feel comfortable. And I love the idea of giving other people the same feeling. And then he took earwax out of my ear one day, and I was mesmerized. I'm like, oh my god!
I just had that done. It's amazing.
It's amazing.
I think I need to have that done. It's amazing.
I was like, yeah, but I was mesmerized at that point. I've always been fascinated by biology and science, and I knew I had to be a doctor just to know that stuff, just to know medicine, regardless of if I decided to actually ever do it or not. I just had to know it. And going into med school, you guys remember, you're trying to pick what specialty you want to go into. And at that time, I wasn't considering, for me at that time, I didn't understand plastic surgery. And I thought plastic surgery was superficial and stupid and non-medical. That was like my idea. And this is how stupid I was. So I thought it was like non-medical, but then somehow I thought orthopedics was medical, right? It's like carpentry. And I thought that was the medical. And I was deciding between ortho and then head and neck, because I loved head and neck oncology. I loved the extirpations, the recon, and that excited me in like such delicate anatomy. And every symptom of every system comes out in the head and neck. So that ties you into having to know the body. You have to really know everything about every illness, because it all comes out in the head and neck. And you're seeing someone as a head and neck surgeon, and you diagnose something that's going on in their body, basically. And I thought, okay, that entices me much more than ortho, which was for me very comfortable because I grew up doing carpentry. Like I grew up doing tons of carpentry, and
I saw upholstery and stuff like that.
yeah, lots of stuff. So for me, that was second nature. And I really just liked head and neck. Then in head and neck, I was at Columbia and Cornell. And in my third year, I was running the residence clinic, like the main clinic, and I just started crying every day because I would tell people they had cancer, because it's your job to
Yeah, it's
diagnose
depressing.
them they have cancer. And it was, yeah, and I couldn't handle it. And I started to feel differently than I'd ever felt before in my life. And I'm like, what is this feeling? Is this sadness? What is this? Figure it out. And that's the first time in my entire life that I decided to abandon my goal. I set my trajectory and I just always go. This time I'm like, you know what, we got to deviate. So I decided at that point I'm gonna do reconstruction instead. So I started looking at free flap fellowships, Mohs fellowships, all that, to say, let me just do the recon and maybe I can just do plastics and then maybe vascular birthmarks, because I love vascular birthmarks. At the time, I had a lot of exposure to it, which is still head and neck and body tumors. Basically, we did everything, but they're vascular tumors, so nobody's dying of a malignancy. And once I got exposed to plastics, and this was with oculoplastics, plastics, and facial plastics, I saw the cosmetic side I was exposed to at that time, and I thought, like, wow, this is like way more difficult technically to get perfect than patching on a flap here, there, whatever it is.
Totally.
And for me, that got me excited, where I said, you know what, like, I love the aesthetic part, even though I didn't want that. I always wanted to be the lifesaver. I love doing trachs. I love being the lifesaver. But at this point, I say, you know what, this is like technical expertise, and that makes me happier. Like, I just want to be really, really good at stuff. So I went into facial plastics from that point, and that's how it all went. I was supposed to be a recon guy. I moved back to LA with really strong recon background, a lot of Mohs reconstruction, vascular birthmarks, so huge anomalies. We're talking about, like, big nerve dissections, flap rotation, all this stuff for the birthmarks. And I moved to LA and I did that stuff for maybe the first year or half year, and then it all just went cosmetic, because that's where my practice just went.
Yeah, it seems like a perfect way to marriage your initial love for medicine, and then your artistic side, with carpentry and stuff like that. But who or what in your childhood got you into upholstery and sewing of Victorian lampshades?
My mom, I was sewing from a young age. Like, I was like 8, 9 years old, and I was sewing stuff. I had even like built like a trampoline. I'd done like a lot of little things, and then she got me involved in lampshade making. She had a Victorian lampshade, like a store basically. So I would make those, and I worked around the house from when I was a kid, about like 7, 8 years old. I like wired the house for cable when I was 8. So like illegal. Remember when you used to have?
Oh my god!
Yeah.
Well, I wired the whole house, through the drywall and everything when I was 8 years old, 9 years old.
Crazy.
And my dad was inept. Like, he just couldn't do anything with his hands. So I was making shelves, hanging shelves, building this, building that. Like, so I'd always just been into it. And from an early age, I was into cars and boats and just doing mechanical stuff. So it's always, it's fun for me. It's like, just like surgery. It's just another game to play.
Do you still have any of those lamps?
I do. They're at my mom's house.
Oh, that's really cool.
So then you moved out to Beverly Hills or LA, and you were saying that, the first year and a half, you were doing like vascular anomalies more so. But then what in your head, arguably the most competitive aesthetic market in the world, how do you decide, I want to tackle this here, and how hard was that?
I'll say why I came back to LA first, because I was in New York for about 7 years, and I'd done, both my fellowships there and residency, and I was having a blast. But ultimately, I was just wanted to come back home. I'm a sun worshiper. I've been racing boats since I was about like 10 years old on fast boats, and I started tracking cars when I was like 16. So for me, the outdoor lifestyle was necessary, and I decided to move back because of that. Now, when I moved back, I started just looking for advice from everybody, and I met with dozens of people and try to talk to way more than that, who wouldn't even give me the time of day, because they're busy surgeons. And the ultimate reply I got from most people, which is the view of most people, is, hey, this is a competitive market, competition. Why don't you just move to Santa Barbara? Why don't you just move? And it wasn't necessarily malignant what they were saying. Like, some people were just like legitimately thinking like, you're better off starting a practice somewhere where there's no other surgeons around. Now, that's the exact opposite of reality, though. So this is what everyone believes, and they have this idea of competition instilled within us, like it's normal, like it's a problem, like it's an issue, and it's so wrong. And it's mostly because I have plastics residents, I have I have ENT residents, and I have ocular residents, and I see all their mindsets and how they talk about things. in plastic surgery and the culture, it is taught competition. Like, it's normal to be competitive, and competition is a part of it. You have to worry about competition. Realistically, we're in medicine. There is no competition. It doesn't matter. There's always going to be tremendously more people than there are us. So that's the reality of it. And that's aside from if you have talent in any field, competition doesn't matter anyways. People will come to you. That's aside from that. I'm talking about the talentless people don't even need to worry about competition. Even the talentless.
Yeah.
You just have to figure out how to get
So I have a chance.
Maybe that's why like all the fast food chains open up next to each other, because they're like, as long as this is where everyone's coming, I don't even have to be better than them.
So this
Great
is
point.
It's exactly the point. It's exactly the point. Talei, which was sold to me as a Shark Tank, is actually probably the #1 place to be in the world for doing any kind of cosmetics or cosmetic surgery or cosmetic dentistry for that matter. There will always be more people. Not only that, you have medical tourism. So I tell my residents who come through, and I tell every single one of them, I say, listen, as you're going through and planning where to live, you pick, is the job more important or your life? And if the job is more important and you're a fucking dork and you really are dying to, go be in whatever university, then fine. Sacrifice. It's my dream to be at, in Boston. It's my dream to be wherever at this institution. And you do that. If your life is more important, then pick where you want to go and just make sure that you go somewhere that has a population that's adequate for you. Mm-hmm. Because you can't go into Bumblefuck and go move in where there's a population of 1,000 people and become a successful surgeon. You're going to be trash. You're going to have no volume. You're never going to be good. So the question is not about the thought of competition. It's more, will the market feed me? And is there enough? And then how fast you become successful or how successful you become is different than, am I going to do okay? Everyone's going to do okay everywhere because, again, like, I know it's a luxury what we do in cosmetics, but it is in this world, it's a necessity. So it is not just a luxury. So you'll always be fine. It's just how successful you get and how fast you get successful. That is determined by you as a person and what you do, which there's part of it that's out of your control, like your personality. Some people think there's a word called like networking, and they go and they network because they're socially awkward, right? Versus an affable social person is like, what are you talking about networking? That's normal. I just go out and people talk to me and I like to talk to people. So you have to be realistic with yourself, what kind of person you are.
Do you think that your personality, so gregarious and everything and sociable, do you think that helps, with the social media boom and it was the right timing? And, how does that fit into your practice and branding? And maybe it's kind of, perfect for you.
Yeah, it works for me very well. But I would say that any personality can work for anyone. It's just don't try to be fake. That's the only thing I would say is don't, someone who is a complete introvert, you have to look at yourself and really lean into your
awareness.
So you never have to act like someone else. There's enough patients out there where you act like yourself or responsibly or nerdy or whatever you want to be, and you will attract the patient who likes that. Nobody's coming to me who wants a substantial amount of hand-holding and coddling and for someone to be dead serious because they think that makes a good doctor. They're not going to come to me. They go to somebody else. My plate is full with all the other people who say, you know what? I think this guy's easy to talk to. He makes me feel comfortable. We're on the same wavelength. I understand him and I trust him because of his personality and because he's direct and straightforward. So being sociable helps. Definitely, it makes things easier. However, the opposite, you can use it as well. And in medicine, it's great to be the direct, quiet, not terrible bedside manner, but very stern bedside manner. That works well for people too.
Yeah. I love this perspective because it's very unique. I think this is the first time we heard this, and Hank, your comment about how it's like, food chains opening up right next to each other, but it's very reassuring to hear that. And it's funny because with previous guests, when we've asked them about their careers and we've said, can you pinpoint a time and looking back where like things pivoted? Like for me, I always thought I was going to be a lower extremity reconstruction surgeon, and then in training, and then I came back and now I'm mostly breast. So you talk about, and I trained at MSK too for my fellowship, and they have an outstanding head and neck fellowship. And I had a lot of friends who did that, but You talk about going back to LA and then pivoting your interest in your career. Is there a moment in time where you said, crap, like aesthetics is my thing? Like I either nailed this facelift or I nailed this case and this is what I need to do.
Or a certain mentor or something.
Yeah.
No, so that's more of an eventual evolution and understanding of things. So as I started practice, I thought, okay, I'm going to come in, I'm going to be the hot shit, I'm going to do everything, do vascular birthmarks, do Mohs recon, do cosmetic, I'm going to do all of it. What you don't want to do and what I knew not to do was to try
Did you go straight into private?
Yeah.
Straight into private?
Yeah. And I'll tell you how actually, but I decided very early on, it's a mistake to try to force yourself into a niche. So this is where people who don't understand the market and how markets work and how people work, they say, you know what, I need to go do something that no one else is doing and specialize in that. So then people come to me and I get known for this. And that's great if you happen to be superhuman at that one thing, but you're likely not. You're just kind of it's like forcing yourself to have a nickname, right? You can't just go walk around and tell people, hey, my nickname is Bugsy. This is like this kid in high school. People, my nickname is Bugsy. We're like, dude, you can't just pick your own nickname. It will.
I'm like Pistol Pete.
Exactly. But the nickname is given to you. And this is how the pivoting eventually works, is as long as you leave yourself in an open position where the market will determine what you do or your talent will determine what you do rather than an external force, everything will evolve according to what you're good at and to what people want from you. External force would be you joined a practice who says, we need you to do 50% this, and then the rest of the time you do your facial thing, or you work for academia and you're restricted in the referral pattern or whatever else. That's an external force where it won't naturally evolve for you. Okay, so the best evolution you can have is you do whatever you want to do at all times, and you go into the market, and whatever market you're in, Beverly Hills or New York or whatever, will help kind of guide what you do. Now, when I moved to LA, I came out of 2 fellowships and residency, and my mindset was all academic. All I thought is I need to go find an academic job because that's who I am. And I'm a birthmark surgeon at that time. So I go to UCLA. I went to plastics, who had the main recon program for pediatrics. They told me to fuck off. I went to facial. They told me to fuck off. I went to USC, both plastics and facial plastics. They told me to fuck off. I went to dermatology, same thing. I went to Children's Hospital and they said, okay, you can operate here. We're just not going to pay you. I'm like, all right, that's fine. So ultimately, speaking to academia wasn't happening. So I started talking to groups to say, at least let me join a group. You want this comfort of going in and having some salary and what you think is, I really need referrals from people, right? And this is what everyone thinks. I really need referrals. I need to go network. I need to get referrals. I very, very quickly figured out, and this is after now he's like one of my greatest friends, Garth Fisher. Before he had met me, the guy's busy. He had no time to meet me. I kept trying to meet people to get their referrals for me, for saying, I do birthmarks. I'm not going to take what you do. And I kept going to try to find referrals from people. Ultimately, very early on, I said, fuck this. I'm going to develop my own referrals. I'm going to go market myself straight to the patients, straight to the people. This is when social media was just starting, like 2014. And I'm going to become the referral source. And that's what I did. So fortunately, at that time, I kept looking around. No group practice wanted me. So I spoke with Kat Begovic, she's over here in Beverly Hills. And she had just moved out of an office that was 1,200 square feet that she was sharing with a plastic surgeon here, David Hopp. And she left and said, Ben, you know what? Fuck all this. Just move in with this guy. You can get super low overhead. It's in the middle of Beverly Hills. It's a tiny little office, but who cares? And that operating room you were looking at renting is in that same hallway. So I go see David Hopp. He says, no problem. This is the office, 1,200 square feet, 2 exam rooms, olive green. Okay. Not the most appealing place, but he's lovely. And he says, $3,800 a month is your rent. You can use Veronica, who's our front desk person, is yours. And I'm only here half a day, twice a week. The rest of the time it's yours. Nothing else. And I'm like, okay, do you want to sign a contract or something? And he said to me, Ben, contracts are for when you want to fuck someone. Are you planning to fuck me? No, Dr. Hopp, not. He goes, well, I'm not planning on fucking you either. If things don't work out, we shake hands and we just go our separate ways. And I said, I love you. This sounds amazing.
Wow.
So I went in and I started my practice by myself. with super low overhead, and I funded it. You have to imagine your first year, you're gonna need about 60,000 base just to like survive and do whatever.
Hey,
So
take notes.
that number,
Yeah, I know. I need this.
80,000, 80,000, and to float that, I had no money, and my family had no money, so I couldn't borrow from anybody. I got 10 grand from my sister, so that was it. I can't get any more.
Did you
And
pay her back?
I did actually. Yeah, she didn't want to take it because my sister, but I gave it back to her. So I borrowed 10 grand. I did locum tenens twice, and I did this weird job where I would fly into Texas and do like septoplasty with balloon sinoplasty and fly back home,
Wow.
make 10 grand in a day. So I ended up floating myself for that year, just going for that first 2 months here and there, barely. And then by 6 months, I was so busy I couldn't get lunch anymore.
Oh. Holy
Wait, but
smokes.
by what time point?
6 months.
6 months. Okay.
Oh my, it must have been your personality and obviously your outcomes and stuff like that.
I was very
I-
proactive. So I started.
I have like 1,000
marketing-
questions.
Yeah.
Yeah, but I'll tell you just as far as the secret goes to that is there is no secret. I was just very proactive. And
Mhm.
6 months before I do anything, it kind of clicks in my head like, get going on this before you get to that time point, or else you're going to have a delay. And I'm a psycho about efficiency, and I can't be inefficient. People always say that, like just like they say I'm a perfectionist, I'm this and that. We all like to think we are, but I am really a psycho of efficiency, and I can't have a wasted minute or a delay in a minute that I could have prevented. So I started marketing myself while I was in my second fellowship. I started doing my website, acted like I was in LA, even though I wasn't. And the first week I came back, I had 2 facelifts and a nose job. The first
Wow.
week I came back. And once I got back, then I just went, hell's like firestorm. I just went as crazy as possible. I was doing meetings. I was part of the chamber. I was just part of everything. And I would just do as much as possible. So, you can never look at success and how to gain success, whether it's marketing, building your practice, as an ROI. There's no return on investment on any single thing that you do. And that's the limitation people have in their heads trying to imagine, okay, well, this is what made Ben successful. This is what made so-and-so successful. People think I got successful because I have rich parents and I'm from LA. I was out of LA for 15 years before I came back, and my parents were bankrupt. So there's like, so the success came from doing everything. And that's hard for people to understand and wrap their brains around. You're doing everything at all times, and you're marketing in a bunch of things that fail. And then you just keep going. It's a game. You keep playing it and go on to the next thing, go on to the next thing, and see kind of what works for you. Yeah, but about 6 months or so, I had a full practice. By a year, I started to suffocate a little in my office. I was working 4:30 in the morning till 10 at night. And this was 6 days a week. I developed, the year after I developed PVC, so I had to stop doing that. But at that point at a year, I realized if I go at this pace, I'm going to hit a bottleneck in 1 year, which means I'm not going to be able to see all the patients I need to see in this tiny little space, and it's going to slow me down and my natural evolution down. And I was scared of losing inertia. So against everything in my body, the fear of build outs and the fear of overhead and the fear of all of this stuff, I went and started looking for a bigger office. And by my second year, by the year 2 and 2 months or something, I had built the second office, which is my current office. And I moved
But that's
in.
awesome.
Wow. Incredible.
It's just what, but if I take everything, like I just said, I have like 1,000 questions, but if I take everything you just said, I'm listening to somebody who has a ton of energy, didn't listen to anybody who tried to like
shoo you away.
Yeah, or sway you in the wrong direction, and just went with your gut and ended up doing what you love. And I think of the same thing from time to time. I'm in an academic center where I'm just fed patients left and right. Like I have to turn patients away because you just keep getting, so I don't have to do the networking, the building of a business, which in honesty, I miss. Like I love that component of everything that you said, like going out there, getting patients on your own, like having that energy. I guess looking back, you talked about potentially having joined a group practice and then where you ended up today. Can you comment a little bit about like what would have been different if you actually ended up joining a group practice? And then do you have any regrets or thoughts over having ever pursued academics? Because you clearly trained in a pathway that was just putting out academic surgeons.
Yeah. So being in my private practice, focusing on just what I wanted to do and choosing myself what days I work, what hours I work, when I see a patient, which patient I operate at what time. I want to do a case on Saturday, I shove it in. I want to do it for free on Sunday, I'll do it for free. I'll do anything, right? So having that open kind of ability to do whatever you want is what really catapulted me compared to my friends. My friends, the places they slowed down were people who try to open 2 practices at once. There's a friend I had, Nicholas Vendemia, who was a plastic surgeon that I trained with over at Columbia and Cornell, and he tried to open on New York and Malibu at the same time. And your eggs are spread, into too many baskets. It becomes too difficult to do. My friends who were in academia and group practices were very limited by what the group wanted from them. There's the opposite case where you join a practice where it's very, they say like simpatico, where you blend into exactly what they need and you are exactly what you want to be. That does happen too. But I'd say 80% of the time to 90% of the time from what I've seen, that's not the case. And you get limited based on when you can operate, what cases you can throw in. Can you do a case for 3? Can you do freebies for collaborations? Can you do freebies for the news? Can you market yourself? Can you have your own phone number? Can you have your own website? Can you put all your money into marketing and it makes a difference for you versus you're scared to because they're supposed to spend for you? So more often than not, as far as like the trajectory I took, I would have been limited if I had followed what everyone else had done. The other thing I didn't do is try to set my value when I started. And this was something that in the group practice, you don't really have that much control over. Or if you're a megalomaniac and don't understand the market too, you think you're a valuable human being. And, I hate to break it to you, Hank, like you're not worth shit right now.
Yeah.
And when you come out, you're not worth shit. And you have to,
I agree.
And
he agrees. He tells me all the time.
But you have to embrace that and realize you're not there to be expensive. You're not there to make money. You're there to be successful. You're there to be better. You're there to grow. Like that's the fun of it. The money, who gives a shit? Like I grew up with no money and I was always comfortable. We didn't care. We never were poor. We were never anything. And we don't care. And when you go like that into practice, what happens is you end up taking every dollar you make and you just put it back into the practice. And you don't care if you made a dime that year. I donated 50% of my whatever I had remaining my first year to charity. And then the second year, and it almost went over 50%. And my accountant came with my mom and had an intervention. Let's say that's me.
You need a new accountant. I'm just kidding.
So I gave money away. I did cases for free all the time. I never tried to act like the expensive person. Versus my friends who said, no, Ben, like you got to set your price or else word's going to get around. People are going to think you're cheap, you're this and that. And I'm like, I don't care. I'm going to get the best results. And then if they want to come to me and I'm charging, they have to pay. I go, that's just is what it is. They're like, no, but then they expect it. I go, I don't care. I don't have to operate on them. This isn't, this is plastics. Like, they can fuck up.
Yeah.
And so now my mindset, which was do it for free, just go, versus their mindset, do what everyone else did, set your price high, whatever you do, don't be lenient. I make now 20 times as much as they do.
Yeah.
Okay. And it's because money making was never my goal. Becoming good was my goal. Becoming successful was my goal. And successful is not only your surgical talent, but it's a popularity contest. This is, again, there's no ROI. Everyone thinks there's an ROI for something you invest in. It doesn't work like that. It is a strict popularity contest. And you want to be in as many different avenues as possible. So you have word of mouth, you have referrals, you have online, you have social media, you have advertising, you have all this stuff. You want to be everywhere. And you want to do that not just for your popularity, but for your safety. Let's say somebody comes in and your name is Dean Toriumi and one of the best surgeons in the world for revision, but a patient doesn't like you. And in fact, they start to hate you. Then they go buy a website in your name. Then they spend and they're rich and they start spending all these marketing dollars to destroy you. Are you immune to that? So if you're somebody who puts yourself into a million different places and somebody tries to take you down in one of them, you still have immunity to that. So it's the same kind of popularity contest. So when someone says at this point, hey, I'm going to go write a bad review about you. And I'm like, wonderful. Here's my website. Here's the, have a field day. I go, just don't go make fake accounts. Just write your review and, fuck off. So, but this is the key to insulation for success, for marketing, for all of it. It's all the same. You have to be everywhere.
Yeah. You put in the work, you're all about work, and then all the success follows instead of forcing the success in the beginning.
Exactly.
Yeah. And then the other thing that you alluded to earlier was, by the time most of the patients make it to your office, they've already kind of figured out what type of surgeon you're going to be, what kind of person you're going to be. And it's almost a good match just because of social media, maybe word of mouth, and your popularities. You get to do a lot of the weeding out at the beginning. When you first meet a patient for the first time, I'm still curious what you're actually assessing first. Is it their anatomy, their psychology, their expectations? What is like your first feeling on your end when you come across a patient?
Yeah, well, so first, like how the patient gets to you in the beginning of
Yeah.
your practice, you're not filtering anything or anyone. You just want to meet as many people as possible and get as many people as possible to know you, and you to learn people, to learn the
Yeah.
market, to learn patients' experiences, which if you even patients you're not going to operate on, if you listen to what they've gone through, you learn a lot faster. You learn from all their surgeries, you learn from it, even though you didn't do it. So
Yeah.
in the beginning, you're saying yes to everybody coming. Later on, that filters not just because my personality and social media guided people, but because I filter people out. And there's ways I do that. Now, when I meet somebody, I have everything happening at once. I'm trying to figure out what they need before they say anything. And I'm looking at the motion, everything moving while they're talking. And I want to see them. So I get them talking. So I don't just sit there and say, let me look at you. I just want to watch them as they talk, because you can
Yeah.
see things with their facial movements that it's gonna help me out a lot. So I really want to talk to him for a few minutes before I start really getting into anything. And that's where you're from, what brings you here. And in the back of my mind for the entire thing is my radar is going like this, like, are you crazy? Are you crazy? Are you crazy? Or I think, are you gonna fuck me? Are you gonna fuck me? Are you crazy? Are you gonna ruin my life? So those two things are happening at the same exact time. And what you want to do is get an assessment of both to see, number one, if you want to do the surgery or if someone else should do the surgery, or what things that they really need. And then you're reading their personality as you're explaining to them what they need. So that's a game you have to learn how to play. They can come in and just say, I just want this and that. And that's what it used to be for me. Now, because my social media is all about full facial rejuvenation, I get people who come in and they say, I've seen you do this so many times, analyzing and talking about the case and how you chose what was needed and you did only what they needed, not more. So I just want to
Yeah.
ask your professional opinion. That's what I'm here for. You're the expert, and I want to see what you see, because they know that I see things that other people don't see, or I see things
Yeah.
different. They're genuinely curious. So I started with that, and that's usually how it goes. And as they're, I say, like, what bothers you? They just give me a one over, and I say, okay, well, do you mind if I just tell you what I would do if I had a blank slate? I get to do whatever I want, or carte blanche. And they say, yeah, go for it. And then I go through, and as I'm describing to them things, I have to look at their reaction to see,
Yeah.
is this somebody who is scared of surgery? Is this somebody who's anxious? Is this somebody who loves everything I'm saying and just is like, give me everything? So you have to throw things out at them to read how they're feeling about it. Because what you could do the most perfect surgery in the world. This is every surgeon will tell you this. You could do the most perfect surgery in the world. You cannot make an unhappy person happy. Okay? You can do the most perfect surgery in the world. If the patient has a different vision than you have, you cannot make them happy. Even if you did the perfect surgery that they verbally asked for, and you didn't understand that their visual expectation was different. And in the end, before you say I'm going to do anything, before you say those words, just think, are they crazy or not?
Yeah.
You
And
know,
do you want to do this?
I thought about a lot of what you just said, and somebody like you who has like built such an incredible reputation. I think to the amount of patients that I've operated on, like I think I have 500 reviews online right now. But when I get one bad review, it really stings. And I was on this like Facebook group the other day where this one patient was trying to bash one of the breast surgeons at my institution and kept talking to other patients and saying, don't go to that person. That person's bad, and like spreading just these bad. So like, how do you at your level like deal with, because it must sting. Like we all want perfection. You're talking about how you're, incredibly OCD. You want perfection, all these things. How do you deal with like the one unhappy patient that leaves like a bad review?
Yeah. Well, so it's as far as a litmus test goes to see if you're a sociopath or not, and you fall into that cluster B. If somebody leaves you a bad review and it just like eats you up to no end, or they're unhappy and it just eats you up to no end, or you just can't stop thinking about these things, then you're probably not a sociopath. I myself, I deal with it better now than I used to. At the beginning, when you're building your reputation and you don't have a strong foundational basis for the reputation, every review matters, and it's a big deal. So at that time, I did everything I could for just like basic reputation management, keep everything clean, whatever I could do. At some point, I had flooded the world with so much of me that it didn't matter so much to me anymore. And it doesn't mean it doesn't bother me when I get, a bad review, but I have a different outlook that makes me feel better about it. Number one is I realize that in this interaction, whether it's a bad review or someone trying to sue you or extort you, which extortion, Hank, get ready for it.
My gosh.
Around these parts in LA and New York, you have to realize that that person was crazy before you met them, and they were living their life just fine. And the one variable that got introduced into their crazy life is actually you. So you have to understand that they're just being crazy like they always were. You're the one who introduced yourself into their lives, and then you connected. You have to blame yourself for these things. So that's one thing that helps me, is realizing like this isn't a normal person. This is like a fucking psycho. They were psycho before. It's my fault for not seeing it. And you kind of just laugh at yourself at what an idiot you are. The other things you look at is, well, a 1-star review is just ridiculous, right? So this isn't a really unbiased kind of objective grading scale. This is, I hate you or I love you. I want to destroy you or I want to help you out and help other patients out.
Yeah.
So the 1 to 5 is really like worthless, right? Like we're just 1 and 5. That's all it is. Do I like you or do I hate you? The ones are so 1 that they sound so fucking crazy when they write their stupid ass reviews that it becomes at this point another way of filtering out equally stupid people, where an equally stupid person would go read that and say, wow, I'm so scared that Ben only cares about
That's
money.
a good point.
That's a good way to look at it. It's filtering out.
Yeah, because what the 1 does is, like, you have no reason for people to hate you. Like, you haven't done anything. You're a nice person. So what do they do? So any review you look at me that's a bad review has nothing to do with who I am. It's all about, all he cares about is money. He told me something which he never said, So they demonize you. And when someone is reading this, there's a tone in it that resonates with them or not, right? If somebody reads it crazy, the demon tone is going to resonate with them, and you just avoided that person.
You're right.
The normal people will read through and get a sense of everything and say like, wow, people like say they owe their lives to this guy. And this one is aggressively saying they ruined their face and destroyed their lives, but they're not showing a picture. It doesn't make sense to the intelligent.
Yeah.
These things help me a little bit. It doesn't mean it doesn't bother me. It still bothers me. I still try not to read them if I see a bad review. I just send it to my manager and I'm like, see if this is something real or see what it is. It's rarely going to get to the point where you're going to sue someone for defamation, even if they're lying about you, because then you've engaged a psycho and tied yourself even closer to them. You want to distance yourself from them. So I would say, for people, just like, get as many good reviews as you can, get an ocean of them out there. So then when the 1 comes or whatever, you're like, I'm still a 4.9 GPA. Okay. I'm fine with that. It's not a big deal.
Yeah. I love that perspective. Okay. So now talking about a little bit about your footprint and your contributions to our world, what we do, facial plastics, you have a very unique perspective on many things, but on things that I sort of admire myself are like your eye for the perfect lips or the perfect brow and cupid lips and periorbital aesthetics. What can you say you saw at the beginning that you could do differently? Or what do you think, this is something that you may have contributed or solved when it comes to periorbital aesthetics and lips?
Well, for the whole phase, I would say patients come in and they ask me this question, which they ask everybody, is what's better about your technique? What's better about your technique? And I fell into this same trap, and you will during, for some people, their whole careers, which is the routine. So it is normal. I fell into it for several years where I was focused on technique, thinking that determines if you're good or not, or that will help you avoid your failure, or whatever it is. You think it's the technique, and patients think that too. Now, when a patient asks me that, I say it's absolutely not my technique. I go, my technique means nothing. My abilities mean something, but the most important thing is my vision, is how I see things. I'm able to see things and understand things about your face in a way where I don't need an MRI, I don't need an X-ray. I can see things other people can't see, which means I'm able to fix things other people can't fix. And I'm able to fix them in a better way than most people can fix. It's because of the way I see things. So you're not getting a technique when you come to me. I'm not going to sell you a technique. I don't sell a technique. Use these names as gimmicky terms because you have to have something to help, people understand that you're unique, but they're gimmicks. So realistically, you're getting me and my vision and what I see. That's what you're gaining. Now, in the lip world or in the brow world, these are two areas which very clearly, and I can go march back to every article that is the landmark paper or the foundational basis of understanding for brow lifting world and lifting world, the foundational understanding is completely wrong. And that's not a big blanket statement that, oh my God, he figured out something genius and he's just saying everything is wrong. It realistically is wrong. Like when you go look at the foundational understanding of brow lifting and the foundational study of lip lifting. Now it's interesting, these two things, because they have the same foundational fallacy, which is, if you look at most of brow literature, they look at brow shape, brow contour, brow whatever it is. And to figure out what a beautiful aesthetic is, this is what people talk about, which is nonsensical, but they say to figure out what a beautiful aesthetic is, I'm going to go and look at supermodels and I'm going to measure supermodels' arcs, brow, and this is what they did. This is exactly what they did. So
Wow.
yes, now this is a very cute idea for somebody who has no insight and thinks that we're playing Mr. Potato Head, right? So they think we're playing Mr. Potato Head. No, I don't know about the belly button stuff. That might work. But for the face aged or changed a certain way, and you just put it back to what it was. You don't go look at someone else who is a supermodel and use that to make your patient prettier. It doesn't make any sense. So the foundational basis of brow lifting is looking at supermodels, measuring where the arc was, measuring where the peak was, making this the specialty, making this the specialization and what you look for. They made it that. It's not that it's true. They made it that. And then they applied it to someone's face. And now what do you have? You have a world of psychotic looking people who look like this all the time. And the entire field is so filled with the wrong idea that when I talk about the right idea, which is it's so basic, anybody can see it, anybody can understand it, anybody can reproduce it because they understand the anatomy, but it's so prevalent, all the bad, wrong idea, that people can't let it go and say, oh my God, what he's saying is just so logical and clear, and I understand it, and it doesn't involve any of these things where I take someone else's face and put it on this person's face. Lip lifting is the same exact thing. These same idiots, same guy with limited understanding of beauty, okay? Now, in cluster B, in this whole narcissistic world, and we tell ourselves we're artists and we're creators and we're so creative and we're incredible and we're Picasso and we're sculptors, there's a level of creativity in there that just ought not to be in there when you're dealing with a human face, right? It's a sacrifice we make, is we have to become arrogant to be surgeons in the cosmetic world. They went and started measuring the upper lip on supermodels, the same thing. Measured 10 to 14 millimeters, 11 to 14 millimeters on supermodels. This was the foundational basis for how short to make a lip. Legitimately, this is what happened. So you have two things on the face, which their foundational basis is completely wrong. So what happens ultimately is the results are inconsistent and wrong. Facelifting suffered the same thing for a different reason. People didn't understand what wrinkles and pores and that kind of stuff was, skin excess, what it really is. So they look at the face and they see wrinkles, they see pores, they see what they think is skin excess, not realizing how those wrinkles got there. They think it's a dermal issue, not that the face deflates and the skin stays the same. So the outer framework stays the same, the inner framework shrinks, and it corrugates. So, and people think in fat pads, that's for dead people. It's actually layers. So you have to think about it as layers because everything is uniformly lost in those layers, and some areas are fascial, some areas are fatty. And same with layer 4, some areas are fascial, some areas are fatty. And so you have to know these gradients in the face. But people saw the face incorrectly, and they created something called rhytidectomy. Rhytidectomy means removing wrinkles. Thinking that the problem in wrinkles was skin excess, not understanding that the reason you wrinkle before you have any dermal problems in the majority of the population is going to be deflation underneath. Not knowing, not realizing that the reason you look like you have skin excess is because the volume shrunk underneath and your contours changed So the surface area underneath the skin changes.
Yeah.
The surface area becomes less and the skin remains the same. This is why we're seeing more wrinkles. Now, the understanding though wasn't that. The understanding was that it's a dermal problem. So what do you do if you think you have a dermal problem? You stretch the dermis, because you can do it with your hand and it looks better, and you stretch the skin. Now they kept that idea and they thought, well, it's scarring, it's not working well. Because they saw that when you delaminated the skin, you lost its support structure underneath, and you've now not moved the soft tissue, but you moved the skin type over it, and you've created forever tension. So then they said, okay, let me move this with it so the end of my skin meets the incision a little bit better. I'm just going to move it closer, which is what smatchplication is. I'm moving it closer to the incision, and I'm leaving it hopefully less delaminated, which people like delaminate the shit out of it anyways, thinking that defatting the skin, devascularizing the skin, causing telangiectasias, causing more volume loss, thinking all these things is going to make the skin look healthier. And they kept the name rhytidectomy because they still don't understand why you're getting wrinkles and how to fix those wrinkles. And if you look at, I posted a video today and you see this lady and you see her skin quality, the appearance of it looks so much better. Why is that? Of course, in the first 3-4 months, they have swelling, but even a year out, why is that? It's because I restored the volume, I restored the position, I restored the distension, I restored the contours, and the wrinkles magically go away. And a lady who's 90 years old, which would appear as 10 yards of skin excess, has the same amount of skin removed as the young lady I just did.
Wow.
Okay. So people are seeing things wrong. And this is where I would say I have value in this world is I don't go out looking to change people. I don't go out thinking, I'm not the guy who sits there next to a girl at dinner and is like, oh, you could do your nose. You could do your nose. First of all, it's none of my fucking business to tell someone if they can do their nose or not, if they feel fine about themselves, right? It's just rude. Your job ultimately is we like to make people happy. We're people pleasers, right? You're not pleasing anybody, giving them a complex. So that's just rude. But aside from the rudeness of it, I don't see people that way. When I'm analyzing faces, I'm not thinking, what can I do to this face? Because I'm not thinking what an asshole creative person I am that just wants to change things.
Yeah.
I look at people and I stare at them, and I do stare at them. So we're at dinner and I will stare at their face. But what I'm looking at is how gravity is moving things, how their muscles are moving things, and the patterns. Because once you start seeing the patterns of where's moving, where's not moving, and where it's moving, and how it's moving, then you start to understand how the face aged. And then once you understand that, then you can understand how to reverse it. So this is where my energy is observation, is sitting there staring at the face, trying to get things. And if I have any contribution to this world, is I can take you through a face and I can explain everything that was a mystery to you. Okay?
Wow.
Almost everything, not everything, but like substantial amount of things that were a mystery to you, I can explain. I could look at your surgery and you say, why does it keep going wrong? Why am I failing here? And I can understand why, because I know the pitfalls. I know where I had my own misguided beliefs, and I fully understand not fully, I much more so understand the aging process now than I did before. And with my understanding of different types of ptosis, I can now give greater value to like teaching people and telling them what's wrong and why it's so ridiculous and why the name brow lift is so harmful. Because, and I have this in my brow lectures, what kind of psycho are you if you think that this hairline, which is just hair on top of skin and fat, just came down by itself and has nothing to do with this entire temporal region, has nothing to do with the glabella, has nothing to do with upper eyelid crowding, has nothing to do with anything, just by itself came down. And then you start to create an arc and shape the brow, and let me treat the brow like it's an isolated, independent structure. And it is absolutely not. It is just the shoreline of an entire ocean. So either way, long story short, that's my contribution. Is not the techniques, is that my techniques reflect my understanding. And the understanding is pure, basic anatomy that most people think they know, but they do not know. And I can school them in a cadaver course, or I can school them just by showing them movements on someone's face. And it's a basic understanding.
Yeah. So your philosophy is restoring, what they looked like, 10 or 20 years ago, rather than you would have looked better if you were born with this kind of nose or this kind of,
The rhinoplasty is different. Bony augmentation and orthodontic surgery is different.
Yeah.
Those things are structural surgeries where you can change the underlying structure of the face. And you can do so in a natural way by learning these kind of natural tenets of, how to avoid problems. But with aging face surgery, I'm very lucky because aging face surgery is something that happened with time, which means you should be able to take it back to what it was, the things that you can, right? Not everything can be.
So do you have them bring in a picture of themselves when they were younger sometimes?
So I can look at somebody who has had 10 surgeries or not, and I can understand where they came from just because I've seen so many people.
Yeah.
I've been in there so many times, and I'm good at that. But I do still ask them to bring in photos for me, and there's a few reasons why. One of them is because it's just fun. Like they bring in, it's so nice seeing, like you get to know someone really fast, and they're such lovely people, and you get to see their photos from when they were 20 years old, 30 years old. They're like, this one I got married. So it's a cool process, and just talking to them about it quickly, even. And I'm quick in consults, so it's not like I'm there for an hour. But I love seeing it. So it just entertains me. And I like having it for, like, let's say later they come back and they're like, you gave my eyes back. How did you know? How did you know? And they always say, I'm like, I didn't know what your eyes looked like. I had a sense of it. I wasn't trying to recreate it. I can feel it. I can feel where the hollowing is. I can feel where the movement is. So I'm just putting it back, these things by feel, by volumetric feel, by depressions and by movement. And the feel is telling me what to do. So I still ask for it. Now, the case that it matters to me the most is when somebody has really lost their eye character. So if they lost their eye character and it does bother them or they notice it, I have to see the old photos of the eye because I want to explain to them, this is where it went wrong. Somebody brow lifted you because they think a brow lift is a brow lift. And they go like this. So now you increase space over here and you were supposed to go that way. But someone took you this way. So you still have laxity over here and heaviness there, but you have an increased lid space here. And then somebody went and they took away volume, they cut away muscle and they cut away skin, but they didn't add in fat. So you just lost more volume, even though you had lost volume to begin with age. So let me show you how I can get back to some of what you used to look like. And let me show you the parts where I can't, where you're kind of screwed. So it's so valuable to have the prior photos for that conversation with patients about eyes. All the other stuff doesn't really matter. Like faces, okay, go lip, whatever, you show them. But the eyes are so sensitive to small little changes in shape where you do a ptosis repair and it can round somebody's eye, right? A ptosis repair can from somebody who has a horizontal slit shaped eye, and then you make them look round by taking up the midpoint of their tarsus. So these are little tiny things that change people's character, and it would drive them crazy.
Yeah. It's to kind of segue into the next topic. When you talk about eyes and everything you just mentioned, I can't help but mention Denise Richards. And Denise Richards goes down, and I'm going to date myself, and Hank probably doesn't know some of these names, but, I grew up with three sisters. So names like, Cindy Crawford, Claudia Schiffer, Denise Richards. They have such beautiful, really absolutely beautiful features. Denise Richards has so many wonderful things about her nose, her lips, her overall face. And then that moment where your work with her was kind of exploded all over the place. What do you think made that case like particularly different or challenging?
Well, I'll tell you, people's reactions to it were much more powerful than we would normally see with anyone revealing themselves in media. Number one, because it was a before and after. And it's like a direct before, direct after, and you kind of see the change that it made. But the thing that impressed people is that she looks like herself. And you can say that about any before and after. However, this is like operating on their family member. So it's very different, right? Because they all know her face. And so it really hits home when you operate on a family member and you see the before and after, and you're like, holy shit, you really restored their nature, their character, what was in there, what was in their eyes before. And you're like, I know those eyes. Those were the sexy eyes that I was looking at when I was younger. And you brought them back. So it's like operating on a family member. Now, what was challenging about her case is zero. And this is not an arrogant thing. She's a thin girl who hadn't had surgery before. So it's like amazing. And this is what I was so excited about. She's a super healthy, low maintenance, incredible person. I'm like, this is going to be a cakewalk.
You're so right.
Yeah.
So I was excited about that. How did I achieve the appearance is straightforward. I mean, the brow lift to me is not a brow lift. And I can see the aging changes which happen on the periorbita over time. And that typically has to do with the back of the head. If you look at it, is pretty big and the skin distends around it. And there's not much soft tissue volume back there, right? So you would assume that this area actually doesn't change much with age. The front of the head is smaller and it has much more volumetric soft tissue. Temporal volume, periorbital volume in layer 4, layer 2 once you get over here, layer 1, 2, and 4 over here, and you get volumetric change. And when you look at the big size of the back of the head to the relatively small size of the front of the head, if you shift forward even the tiniest bit from there to there, and then lose a little volume, you're like there. So you end up with all these periorbital changes. And so my job is to restore the volume where I know the gradients of fat are. I restore the volume there. I distend it back to where it used to be. And then you'll see a brow that's like, arched and peaked over time because they're compensating from their frontalis pull, which is strong right here. In this, it ends up straightening them back out again. And you get rid of laxity in the SMAS system. So you have this whole system that actually go deeper and superficial, but either way, you have it all tied together and you distend it back out. So their muscle function improves. Their appearance goes back, not to lift it, but to restore, to distend it to where it used to be. You add volume in the upper lid, compensating not just for volume loss that they've had, but also for the skin that you're about to remove. You're about to remove volume. Skin is volume. And so you have to make sure that you've remained kind of cushioned and you don't hollow them and don't increase their lid height and keep them looking like they used to, as much as possible.
Yeah. I loved hearing the technical background to it. And I totally am right there with you. It's like when that patient walks in who has the foundation, it's like buying a home that has just great bones and know that you can do those modifications.
You can just move in.
It's going to make it amazing. But truthfully, when a celebrity case like that goes viral, it can help and it can hurt, and it can, especially patient expectations, et cetera. And then you have to balance transparency with showing results online. There's this whole thing about Kris Jenner, right? Kris Jenner just came out and she was like, you know what? I want to go against everything that's been shown in the media. I actually like my plastic surgeon and I like my results. Like everyone's talking about me not liking my facelift, but I like my facelift and it went well. So how do you think all of that helps or hurts you?
Well, my situation was easy just because it was transparent from the before and afters and a little bit of the healing process stuff that she had posted and talked about. So it didn't really hurt me so much. For Steve Levine, unfortunately, what happened is Chris posts photos and she has photos out there. The photos, they look so fantastic and you don't really have a baseline before and after. And she just looks great. She's a very beautiful person and she's on TV. But then two things happen to Steve now. Now, one is everyone thinks they can look like that because there's no baseline, no history to it. So it's probably more stressful for him. It would be for me. And then the other is everybody wants to take him down because they're jealous. And so they see, and they start making this about, oh my God, let me use this to my advantage because I'm a little fucking psychopath. And let me talk about how it was successful because it's in the SMAS world of things, which first of all, these guys don't even understand. It's completely different than a SMAS glycation. It's entirely different. Hence why Dan Baker's results were as strong as the older deep planes. There's a reason it was good. It's different than whatever. But these guys come out and they use it for their own advantage to talk about, not only to talk shit about Steve Levine, who's fantastic, and they could never be a fucking tenth as good as he is. They want to talk shit about him and they want to use it to promote their own techniques, to say, this is why I'm right. This is why, and you could use it two ways. You could say Kris Jenner looks like horrible and it's because she didn't do my technique. Or they say, look, Steve used a SMAS technique and that's what I use and that's why she looks so good. And you try to sell it to everybody. So you have this whole shit show revolving around it. Now, in the end, who cares? Don't feel bad for any of us. We're all, super excited when anything goes public like this and you get recognition for it. It's great for us. So even if you get the negatives out of it, it doesn't really matter. I would say though, let's say someone like Denise who has superhuman healing, then every patient comes in and they think, okay, I'm going to look that good at 1 month. And I have to have this talk with them if they ever bring it up. Oh man, that patient looked good. After I told the person, you don't look like shit. Okay. I'm you're going to look horrible. 3 weeks, you're going to look camouflageable, disguisable. 3 months is how long it takes to look good. They're like, no, well, I have my fingers crossed. I'm going to heal as fast as so-and-so that you posted. And I'm like, no. I go, and that's why I hate posting. And I tell them, that's why I hate posting those things. I posted it because she let me. Now, I posted it on someone who let me because they healed so well, they wanted to show it off. And now everyone thinks they're going to heal that fast. And I try to explain to them, that's not going to happen to you. I'm like, listen, you be all the optimist you want, okay? My job is to be the pessimist. Okay, I'm the surgeon. I'll be the pessimist. You be the optimist. I'm telling you, it's going to take you 3 months. You're going to look horrible. Okay, understand that. They're like, okay, but I hope not. Okay, you hope all you want. Like,
Yeah.
Yeah, it's really about setting the expectations. Is there
100%.
any role for injectables or in your practice?
I was very so if you want to go into facial aesthetics in general and aging face, I would highly advise that you get good at injectables. Getting good at injectables is very good because you first of all you have to treat muscle function as you get older on patients, and that's either you can do it through myomodulation in the surgery with doing certain types of fat grafting can get rid of the need for Botox, and certain types of lifting can, versus some people will always need Botox. So you have to get good at Botox. You have to get good at filler and understanding filler, even if you don't do a ton of it or do tiny bits, just so you're always looking at volume on the face. The more people you see, the better you'll understand. So it's helpful for the aging face surgeon overall. As far as market dips go, where surgeons used to have to hold on to an insurance base in their practice, this is the classic understanding of how we used to run practices: is you have some insurance base, some cash pay. And you do that because you're too young, Hank, to have lived through an economic cycle. But there are these large economic cycles, and the economy will crash at some point. It'll go down, and if you have insurance base, you do fine during those times. Now, I'm saying if you do Botox filler, you're also going to do fine. So as far as having it in your business, it's fantastic, and being good at it to understand the face and to offer people stuff, it's fantastic. I personally was injecting 20 to 40 people a day, and
Wow.
not like super high volumes. I'm not like an over filler, but I was injecting 20 to 40 people a day. This is why I was working 4:30 a.m. to 10 p.m. This is why I got PVCs. This is why I had to cut back working.
Yeah.
And for me, this is one of the things that really set me on fire here in the LA Malibu community, where people really knew me because I had my hands on so many people so fast. Versus
Yeah.
how many people can you operate on in a week, especially in your first 5 years? Not that many. So I'm doing 20 to 40 people a day. And that really got my name around word of mouth, and people got to know me just because of that. Now, I didn't plan it that way. This is just coincidence. I'm just telling you, hindsight, it was fantastic for me. And one of the things that really pushed me forward, at some point, it was ruining my life because I am good at injections. I'm like really good at them. And people sense that because they come to me and I use less product, less this, less that. And it works better, faster, longer, looks better. And they notice it right away. And they're like, nobody's ever done that for me. How did you
Wow.
get rid of it? So once that happens, then people will come to you nonstop, and you will work 24 hours a day. It'll just keep going.
Wow.
I had to cut it out of my practice, and I ended up delegating it to a nurse practitioner that I trained. I made her come into surgery with me to watch surgery, to learn the anatomy, to see the anatomy. So there's no mystery of where she's putting her needle, right? And I've used this in talks before. I say you never want to use like a glory hole, right? Like at a truck bathroom.
Yeah.
Like you want to inject and not know what's on the other side. And this is the same with injectables. So I delegated, and then we got so busy, I brought someone else, and I opened up this place called Cupid Lips, where I have them. And this sounds super sexy for like young surgeons who are like, I'm going to go out and build something. If you talk to the people who have these med spas, okay, or whatever they are, it causes you more headache than goodness if you're a busy surgeon. So if you're a busy surgeon, it's going to give you 70, 80% of your headache and 20% or 10% of your actual income. So just realize that that's the reality.
That's good advice.
That's
yeah.
very good
If you're
advice.
a bad surgeon, then open up med spas, and you're going to, it's a great thing to build and ultimately sell.
And we only have a couple more questions. We've been having such an amazing time. I know time got away from us a little bit just because you're so amazing to talk to, and we're learning so much. So we appreciate you taking
Yeah, I
the
almost
time,
want to come to you
promise.
for a facelift.
But something I just really, as a resident who all I know is work, but there's going to be a time when I'm an attending and I can, like, if you have your own practice, you can delegate, how much time you want to be at work, how much time you want to spend with your family, how much time you have for your other interests. And to kind of bring us back to the beginning where you were saying, do you want to be the guy who's all about your job, or do you want to go somewhere who, you have a life as well? But it seems like you're someone who's working nonstop, but you also have all these interests. You are a carpenter, you're racing boats. I know you have a piano background and all these other interests. How do you oh my God, see? We needed to look around. This looks
And that's the garage
such a
over
fun
there.
house. But so how do you make time for all this stuff? And how do you become an expert and a master at your job, which I know you spent out, you were working 4:30 to 10, And I know maybe it's a trajectory, and over time it kind of evolves. But yeah, can you talk a little bit about that?
So I'm single, not married, no kids. And that is a massive advantage. Now, you never plan it that way or want it that way. Coincidentally, that's how I've been. And I'll get married at some point and have kids at some point. But that in itself allows me to be very selfish and very independent and not worry about somebody else, having to care for somebody else or even a dog.
Yeah.
The schedule remains flexible. Now, from childhood, I was always known as the kid everyone who thought they were hardworking and this and that. Like I was terrible in like going to school, but I was always the one that could do things for longer without sleeping. And that's the main secret is some people can, some people can't. And I just spend every minute doing something efficiently. I don't leave a gap doing nothing. And I would go home at 10, go out, meet some friends until midnight, go back to work at 4:30. And I would go, but this is how I got PVCs. So I would just keep doing it. And even now people think I have, abnormal amounts of energy, but I've hit a wall. So at this point, I don't have that energy. I still have more than my friends do, but you kind of lose that over time. But that is what really had me happy at all times, whether it was in med school, residency, whatever it was. I was very good at efficiently managing my time, not wasting any time. So I got to do a lot of things with value to them. And that was hanging out with friends, going to parties, a lot of partying, working on the cars, working on the boats. I work on all my boats myself, whatever I possibly can. I just do a lot. But now I'm changing. So this is the year of not doing that. After my PVCs, I said, okay, I need to stop working so much. That's when I cut out injectables. Then I cut out half and I kept working 6-7 days a week again. I cut out half, I kept working 6-7 days. At some point, and I kept remembering back to the time in residency that I was crying, telling people they had cancer, and I had to pivot away from my target. And this is another time where I thought back to that. I'm like, I did it once, I can do it again. I'm going to abandon something that I worked so hard to be good at. So I abandoned the filler Botox world. Then a few years later, after COVID, coming back, things start getting crazy again. And COVID's what saved me. I was about to collapse. And I go back and I realize I'm killing myself again. I liked how I felt in COVID time. I cut out rhinoplasty. So then I had more time. Then I decided, let me go to 5 days a week from 6. It never worked. I went back to 6 days. So I said, let me go to 4 days a week and then maybe end up at 5. So I did. As soon as I did that, I decided to open Cupid Lips. I opened a hair transplant center.
Yeah.
Started lecturing more. I did 52 lectures 3 years ago. I did 42 2 years ago. I did 25 last year. This year's 13. So I'm going down and down on how I'm doing things. And now I am getting a 4-day work week with Fridays off. Because
that's amazing.
I'm not going to lecture anymore. People have gone crazy with these lectures. It's like they're just making them all over the place.
Yeah. Yeah. I have to ask you, I've been looking at this panda artwork behind you. Where is that from? And is there a story behind that? I love it.
My friend got it from a garage sale.
That's awesome.
Oh, wait, is that a car? I didn't realize you had a car.
BMW Isetta. I have 6 of them. So that's the one in my house. Cool. I have one in the driveway. My house is sort of it's sort of like a 5-year-old, like a 10-year-old. You know the movie Big?
Yeah.
So it's like someone
with the piano.
Yeah, but it's like someone from the movie Big.
Oh my God! Look at those cars.
Beautiful. So that's the living room.
What's in there? Is that
that's a Ford GT. That's a Countach. That's a Carrera GT. That's a 356A Porsche. And then I have my kitchen.
I love that you see it right from the kitchen. That's amazing.
So that's a Jaguar E-Type. That's a Mercedes McLaren SLR HDK. And that's an Aston Martin DV6.
Okay, I guess I'm never having kids.
So I also became a car dealer. Those are less than half the cars, but I have 6 of these, and 2 of them are turning into hot rods.
My favorite car since I was a kid in that same exact color is that Lamborghini.
The Countach? Yeah, that was it was a poster on my wall.
It is such a sexy car. It is beautiful.
Amazing.
I think that it was one of the best Lamborghinis.
Oh, for sure.
I love Ferraris, but that was the one Lamborghini that I thought was gorgeous.
I was just driving it today. So I drive one every day. I have 7 here that I rotate. I have 2 in the house next door. I have 2 at my brother's house. I have 2 at the office, and I usually have a couple at the shop.
My God.
But Hank and I are coming to LA in a couple of weeks. We're taking the podcast to LA actually for a conference. So if you need anyone to drive your cars around.
But okay, so our last two questions are just, what music do you listen to in the OR, and what's your favorite surgical instrument?
So the music is just anything upbeat. I can't listen to Sade or anything kind of slow, and I can't listen to heavy metal. I need something with a good rhythm and a good flow, because when you're tired chronically, it helps to have that kind of sound and that rhythm going, and it keeps you at a normal pace versus, sometimes I just start stitching like everyone else. And
Yeah.
I always have to have something upbeat, and that's from a lot of reggaeton. I like rock, country. The girls in the office don't let me listen to. We listen to a lot of like hip hop, 90s hip hop, rap, that kind of stuff. My favorite instrument, that's easy. It's the penetrator. So I have 3 retractors that I developed for the neck. There's and the brow and whatever else you want to do. It's the Penetrator 2, and we call it the Penetrator 2 because we call it the Penetrator 2 because it's the deep neck penetration. But the 2 is because I was born with the Penetrator 1.
That's
so
funny.
It's Penetrator 2, and then and it's a really good retractor, especially if you're doing like proximal gland work, digastric, that kind of stuff. And then I have Le Petit Penetrator, which is the one that we use for brows or after the case, or if you need something narrower, it's more like an Alfrecht. But they're all beautifully lighted. It's the best lighting you can get. And then the last one is the Penetrator Magnum, and that's for those deep, large cavities.
That's
So
amazing. That's
Magnum, which has a little lip on it.
So
broader.
do you design? Does someone come to you with an idea of a design, or do you work with them on what you think could be better for a retractor, or how does that work, or both?
Yeah. So in the beginning of your practice, unless you you don't really need special instruments. Like, you just use whatever's out there, and likely people have thought of it already, what's going to be good for you. Coincidentally, my techniques became repeated over and over and over again. And I saw where it would benefit me to have this little change, that little change. And it was at the same time as glands are kind of getting more popular to resect, even though I think most people should not be doing that. But it's at that same time. And I said, you know what? I have a headache when I do this. This one I need better lighting. This one doesn't have suction on it. And I just developed what I wanted to use, and it didn't exist. Otherwise, I would just use someone else's. And it is the best. That's the best set of 3 neck retractors that there is, hands down. Like when you use it, lighting, and it's not just lighting, it's how the lighting reflects. So like I have a reflective surface on the bottom of the blade, so it reflects outward, so it makes everything brighter. Even I have it proximal and I have it ovoid, because if you have it too distal, then everything up to the tip of your retractor is dark. So I figured out all these tiny things, and it's
fascinating. Yeah,
so good. I love those.
Wow, just incredible. I've learned so much, and I can't. Oh my God, we've talked for longer than we normally do. I'm sorry for keeping, but this has just been incredible. We've learned so much, and I know our audience is going to absolutely love this as well. Thank you for listening to The DIEP End, a plastic surgery podcast. If you've enjoyed today's conversation, please like, subscribe, and leave a rating on Apple Music or Spotify. Video from the podcast is available on Instagram and YouTube at The DIEP End Podcast. Join us again soon for more conversations with luminaries and experts from the world of surgery.